This skill is dressing the resident. So I'm gonna wash hands, knock knock. Good morning, my name's Xavier, I'll be your senior for today. Is it okay if I check your name band? Mary Smith, nice to meet you. How would you like to be addressed? Mrs. Smith? So Mrs. Smith, is it okay if I help dress you today? So I have options for you. Would you like to wear a dark blue gown or a light blue gown? Okay, so dark blue. So I'm gonna grab the supplies, I'll wash my hands. I come back with the supplies, I'm back in the room, wash hands again, and then I'll close the curtains. I'll adjust the bed to a comfortable position, waist level, and then I'll lower the side rail. I also want to know where the weak side is. So notice that the weak side or the affected side is actually on this side. So wherever the hand roll is, that's the affected. So remember the acronym TOSS, POW. TOSS is take off strong side and POW is put on weak side. So first I have to take off strong side. So I'm gonna put on my first set of gloves, just remove the old gown. Mrs. Smith, I'm gonna ask if you can please raise your head for me. I'm gonna loosen the strings here. Wash hands. I'm gonna go to the other side. I'm just gonna set the hand roll over here first. Make sure not to expose the patient. Remove gloves. So here's the gown that she wanted. I'm gonna place this one on top of the back blanket. Remember the acronym POW, put on weak side. Make sure they're not exposed. Can you lift up your head for me? We'll tie the strings. And then from here, I will lower the bath blanket and just put it back on top without exposing them. And after putting on the new gown, we're gonna put on the non-skid socks. And then I can also place the hand roll back. I'll lower the bed to the lowest position, check for body alignment, and make sure that the bed is locked. I'll wash my hands. So Mrs. Smith, here's your call light, your phone, tissue, water, and magazines. If there's anything else you need, just let me know and I'll be back. So I'll open the curtains. I'll wash my hands, step outside, record, and report.